my wife when she was 18 and I was 21. That was before the war. I came home in 42 on leave and we got engaged, and I got married in January 1944. And she's my best friend and we never had a row. Unfortunately, I had a little stroke in my forearm 4 years ago, and my wife said, "You mustn't drive because it's not fair on other drivers." Much to my disgust, you need a car when you live in a village. And it was subsequently I purchased a scooter, and I go down to the village on the scooter.
I hope it's how you like it.
Transport and isolation are the biggest problems John faces in his determination to remain independent. At 95, he relies heavily on good neighbours and the support of voluntary groups.
This is a nice village, the people are very kind, generally.
Staying in his own home is important to John, but to remain independent, he has the support of the Maple Integrated Care Team.
John, this is Lynn. She's the community matron for the Maple team. I work with her within the ICT.
And I'm here today to introduce myself to be able to monitor your long-term conditions, which I see you manage very well. Thankfully, with the support of the voluntary services who have done an amazing job.
John has the help of volunteers almost every day of the week.
I go out on Mondays, go down to Hook. We have the occasional quiz, and it's run by school children, 14 or 15. On a Tuesday, usually. Sue comes and has a chat with me, and she's very good.
Get his email address up first. Yeah.
No, sorry.
Going to put love this time, are we?
Yes.
All right, okay then.
L-O-V-E.
L-O-V.
I have my legs greased morning and evening. I get taken to Fleet on a Thursday for shopping.
Chris Cornwall is a regular visitor to John and devotes his whole week to volunteering. Chris works with several community groups, helping the elderly in many different ways.
Good morning, John. Well, when John and previously his wife needed to go to hospital or to doctor's appointments, we have a team of 35 volunteer drivers who do around 400 trips a year to help people without transport to go to and from their vital medical appointments. In addition to that, we have a team that help people like John and those who suffer from dementia and their carers, and we do that by visiting them usually once a week for an hour or so, just so they don't become isolated.
I think we can work really usefully with voluntary organisations that provide community transport to help them to access our services. Another example of that is Meals on Wheels. If people are going to somebody's house, they may see that they're not as well as they were the last time they're there. They might see that there are signs, maybe they're in distress, they're forgetting to do things and so on. And if we can find ways of communicating very well with these sort of services, we can help to, in a sense, make a more joined up, I suppose I would say, joined up service for the person. They don't care where they get the services from, whether it's from health or from social services or from a voluntary organisation. They just want to be helped.
What Hugh Freeman, the chairman of the North Hampshire Clinical Commissioning Group, is determined to do is to ensure that these statutory organisations have got a full understanding of how local voluntary organisations can work with them to help support older people to remain independent in their own homes. And that indeed is the key objective of the County Council's Older People's Wellbeing Strategy.
Another voluntary scheme which helps support the elderly to stay in their own homes is the Mind the Gardening project. This not only assists older people, it also helps volunteers who may be suffering isolation and loneliness.
So it's the loneliness of volunteers, so to be able to come out 2 or 3 times a week, to be part of a team, to build friendships, relationships, be part of that worthwhile team, but also know that you're making a big difference to lonely people in the community in their own houses. We love to get owners of the properties to come out while we're gardening.
Volunteers in Hampshire play a hugely important role. Without them, Alfred wouldn't get to this day centre and could miss vital medical checkups.
The volunteers are amazing. They provide transport, they do all their meals, their hydration of fluids, all the activities that come in and entertain our clients. At the same time, it enables us to monitor patients with long-term conditions that are coming to the day centre on a daily basis or a weekly basis.
Cup of tea out? Yeah, I'll just do it now, mate. Do you have sugar or not?
Alfred is 84 and spends 1 day a week at Rosefield Day Centre within Odium Cottage Hospital.
Alfred loves to go to the day centre. He would love to go every day. He likes to be quite active, even though he's got quite severe medical conditions. He relies on volunteers greatly. He gets taken out most days, but they bring him to the day centre, and without that, because he lives quite a way out, without the volunteers he wouldn't be able to attend.
We are working very hard to keep the elderly in their homes, which that's what every elderly person wants. It is working, and having the integrated care team, we can all share, we can all bring awareness to each other of those vulnerable people in the community. We can all work together, intervene earlier before the long-term conditions becomes a crisis.
Within the integrated care teams, GPs are working hard to build partnerships with voluntary and community groups.
I think it's an area that we're all very conscious is perhaps a little bit of an untapped source, certainly an untapped source with regard to how doctors, GPs, surgeries and perhaps community staff are using the voluntary sector at the moment. It's an area that we're well aware of, and we really can only see that there are great advantages with all the stakeholders, as it were, working together for the benefit of patients.
The problem about the health service or the local authority designing the services by themselves is that they've often never been users of those services. So there's something that the jargon calls it co-design or co-production, but it's sitting down together, people who understand the service users, people who will be commissioning the services, paying for the services, the providers like Southern Health, sitting down together to design the services, ideally from a blank piece of paper. What would people really want? And sometimes it isn't what they've actually been getting.